Hello and welcome. Today, we're diving into a condition called Lagophthalmos. It's a mouthful, I know, but it essentially means the inability to fully close your eyelids. This can lead to a host of problems for your eyes, so let's explore what it is, why it happens, and how it's managed. So, what causes Lagophthalmos? There are several potential culprits. Nerve damage, particularly to the facial nerve which controls eyelid muscles, is a common cause. This damage can stem from Bell's palsy, strokes, tumors, or even trauma. Another cause is structural issues with the eyelids themselves. This might include scarring after surgery or injury, or changes related to aging that cause the eyelids to become lax and weak. Certain medical conditions, such as thyroid eye disease, can also push the eyeball forward, preventing complete eyelid closure. Let's talk about what's happening on a deeper level. When the eyelids don't fully close, the cornea, that clear front surface of the eye, is left exposed. This exposure leads to excessive evaporation of the tear film, resulting in dryness. The tear film is crucial. It lubricates the eye, provides nutrients to the cornea, and washes away debris. Without this protective layer, the cornea becomes vulnerable to damage. Prolonged exposure can lead to inflammation, infection, and even corneal ulcers. While accurate statistics on Lagophthalmos are difficult to obtain, it's generally understood to be relatively uncommon in the general population. Its occurrence is more prevalent in individuals who have experienced stroke, Bell's palsy, facial trauma, or have undergone certain facial surgeries. Certain populations with higher rates of thyroid eye disease may also see a corresponding increase in Lagophthalmos. How do you know if you have Lagophthalmos? The most obvious symptom is the inability to completely close your eyelids even during sleep. This can lead to a range of other symptoms, including dry, irritated, or gritty eyes. You might experience excessive tearing, as the eye tries to compensate for the dryness. Blurred vision, light sensitivity, and a burning sensation are also common. In severe cases, you might even experience pain or discomfort. Diagnosing Lagophthalmos typically involves a thorough eye exam by an ophthalmologist or optometrist. They'll assess your ability to close your eyelids, examine the health of your cornea and conjunctiva, and evaluate your tear film. They might also perform tests to check the function of your facial nerve. Additionally, your doctor will inquire about your medical history to identify any potential underlying causes. While Lagophthalmos isn't necessarily typed, in the traditional sense, it can be categorized based on its severity and cause. For example, mild cases may only present with nocturnal Lagophthalmos, an ability to fully close the eyelids during sleep, while more severe cases can involve daytime Lagophthalmos as well. Similarly, it can be classified as paralytic due to nerve damage or mechanical due to structural issues. Treatment for Lagophthalmos depends on the severity and cause. Mild cases can often be managed with lubricating eye drops and ointments, especially at night. Moisture chambers or taping the eyelids shut at night can also help protect the cornea. More severe cases may require surgical intervention. Options include eyelid weights to help the upper eyelid close, lateral tarsorrhaphy, partially sewing the eyelids together to narrow the opening, or procedures to correct eyelid laxity or structural abnormalities. Botulinum toxin injections may be used to paralyze muscles that are pulling the eyelids open in cases of nerve-related Lagophthalmos. Unfortunately, completely preventing Lagophthalmos isn't always possible, especially when it stems from unpredictable events like strokes or trauma. However, if you're undergoing facial surgery, choosing a skilled surgeon and carefully following their post-operative instructions can minimize the risk of complications that might lead to Lagophthalmos. Prompt treatment of conditions like Bell's palsy may also reduce the likelihood of long-term nerve damage. The prognosis for Lagophthalmos varies depending on the underlying cause and the severity of the condition. Mild cases managed with lubricants and conservative measures generally have a good prognosis. More severe cases, especially those caused by permanent nerve damage or significant structural abnormalities, may require ongoing management and may not be fully curable. Recent research focuses on developing improved surgical techniques and artificial tear substitutes to better protect the cornea and improve patient comfort. Additionally, studies are exploring the potential of nerve regeneration therapies to restore eyelid function in cases of paralytic Lagophthalmos.